Hey guys, what's up? So, today, we're going to talk about how to care for your fucking dogs, but this is the third time I filmed this fucking video. So let's talk about that drama. So I went outside to film because I was like, oh my god, it's going to be so cute. We're going to have the dogs playing in the background. It's going to be great. Then my neighbors decided to cut their grass. So I was like, fuck, okay, we got to go inside. So I came in here, and then I was like, why is it so loud? Why are the neighbors cutting the grass so fucking loud? And then I look outside, and I was like, oh, that's the people that cut my grass. They're here. And now, I'm not trying to be shady or nothing. I didn't know they were coming because I don't control that at all. My landlord does. I pay for that in my rent. So, I don't know when they come. I don't have their itinerary. This has just got a little bit of foundation left on it from yesterday. And I'm just trying to even out my face because I didn't realize how shitty I looked. Anyway, so, today, we're going to be talking about companion animals and how to care for them. You guys have been requesting this video pretty frequently for me. We're going to talk about dogs today. Talk about cats next. And then that's probably going to be it. We can always do like a Q&A to these type of videos if you would like. That's perfectly fine with me. So just let me know in the comments if that's something you want to do. And then I'll post probably a poll on Instagram if you decide that that is like a cool thing. That you would want to have like a Q&A type thing for this. So anyway, without further ado, watch me think that I look terrible. And we'll get started. As usual, if you have not subscribed to this channel, you should. We're closing that gap, baby. Closing it. Because we were at 20-something% of people that watch my videos weren't subscribed. And now we're at like 15% of people aren't subscribed. And that just ain't fucking bad. We out here doing it. So anyway, moving right along with dogs. We're going to start with, you need to know the type of breed that you are buying. This is something we run into pretty frequently in my hospital. People, they're just like, oh, I love labs because they look cool and they're so pretty and I want a lab. So they get a lab and then they're like, oh my god, this lab is so hyper. I have to walk it 100 times a day. We run 5 miles. It's just not enough for her. So I want to get rid of my dog. And that's when we run into problems. So if you're going to get a dog, you need to get a dog that you are aware of their like breed and their personality. So like if you just want to lay around the house dog, then like a lab is not for you. They're pit bulls are not for you. They're very high energy. This looks so much better already. They're very high energy breeds of dog. Like get you a lazy bum dog, like a pug. They're pretty calm after puppyhood. Mini poodles, pretty calm after they are, I mean, all puppies are hyper. That's just the truth. All puppies, because they're babies. But when they get a little older, about 18 months, they usually do calm down, especially after you spay or neuter your pets, which you should do, which we're going to jump into right now. The reason you should spay your female dogs is because it almost completely eradicates the chance that your dog will get breast cancer if they are spayed. After their first heat cycle, that chance of them getting breast cancer goes up like 30%. Spay your female dogs. For male dogs, it is like 80 something. I don't know the exact number, but it's in the 80s. 80% of hit by car dogs are intact males because they are looking for females in heat. Neuter your dogs. Spay, neuter your dogs. Be responsible. Now, if you want to breed your dog fine, you need to be licensed in most places to breed dogs. If you are licensed and you've done all your due diligence and you know what you're doing, I don't think there's anything wrong with breeders. People say it like it's a bad thing. They're like, oh, she's a breeder. And I'm just like, who cares? Like, let people breed dogs if they know what they're doing, you know, and they have all the licensing that they need. Breed your dog. That's fine. Just you need to do it responsibly, because if you're trying to, like, say, artificially inseminate your dog at home and it's unsuccessful and you don't know what you're doing, you could potentially cause your dog to have a pyometra, which is an infection of her uterus and uterine horns, where they actually fill completely up with pus, and that is an emergency situation where your dog needs surgery or it's going to die. Period. Like it will have to have surgery to have its entire uterus removed. Because when you spay a dog, they're having an ovarian hysterectomy where they just take out their ovaries. If you have a pyometra situation, they have to have a total hysterectomy and they take everything out. another thing with people. They're just like, oh, spay and neuter is not a big deal. It should be a quick walk-in appointment. It's actually, especially for spays, neuters too. It's a very invasive procedure. Neutering a cat takes like 10 minutes and it's different. But a spay, it's an ovarian hysterectomy. That's what it is. So it's not this really quick. It seems to be something that people are confused about, because I have people come into my hospital all the time and be like, oh, I'm here to get my dog spayed. I'm like, okay, well, no, you're not, because you don't have an appointment and this is not a day that we perform surgeries. And there's like, it's just a spay. And I'm like, it's an ovarian hysterectomy, number one. And yeah, that's not a quick little in and out. That is a procedure, and it's a pretty invasive surgery, and it's very important. Very, very important. Especially, I know I'm not talking about cats, but I'm going to touch on cats a little bit. It's so important to spay and neuter your cats, because cats are induced ovulators, which means their cycles when they're fertile are not on a set track like dogs. Will go into heat basically the same time twice a year. They go into heat. Cats, female cats, go into heat whenever there's a unneutered male cat around. So if you have one that lives in your neighborhood, your cat could be in heat all the time, essentially. So you should definitely do that with your pets. We're going to move on with puppies here. We're going to talk about food. What I personally recommend, just through my travels and trial and error of being a pet owner for a long time and then being in this profession for a while. Ooh, that's cute. The food that I've always recommended is the brand Hill's, H-I-L-L-S, Hill's. They have Science Diet. They also have Prescription Diet and Advanced Fitness. Science Diet is really good. It's all good. Science Diet is what I've always used for my pets, because you can have Science Diet puppies, toy breed, small breed, regular, large breed, and it goes up from puppy, adult, senior, and everything in between. You can do perfect weight, which Zoe has to be on because she's fat, and it's like diet food. They have all these different types of food to fit your dog's particular needs. Puppy food is really important. It does help a lot with their growth and development for them to be, it's just like baby food. You need to be on this particular diet. You should never feed an adult dog puppy food, because it will make them really fat. They just don't need all that puppies need. Now, I personally feed, well, everybody's on special food now, but like Kevin, who there's nothing wrong with him, he is over puppy food. I normally recommend to feed puppy food till about a year, but his previous owner hadn't had him on puppy food since he was a baby, and I didn't want to reintroduce puppy food because it would give him a lot of GI upset. So he went on the Hill's Sensitive Skin and Stomach, even though he's only 7 months old. Yes, I think he should still be on puppy food, but that's not where we are. So I say leave him on puppy food for about a year. Zoe is on perfect weight. It's all the same brand, it's all Hill's. She's on perfect weight because she is very fat. She got spayed, and then she fractured her fibula, so she was on crate rest for 12 weeks right after she got spayed, which makes them gain weight. And she has gained like 9 pounds, which is like 100 pounds for people. It's a lot. So she is on diet food. The cats are both on a prescription diet because Gunter needs to be on a prescription diet. So they eat Hill's brand. It's a DD, and it is for allergies. And Gunter's allergic to chicken, so they have to eat venison food. And I just put Bima on it as well because it won't hurt her to take it. And they won't separate to eat anyway. They'll eat each other's food because my cats free feed. My dogs are very regimented on when they eat and how much they get and at what times of day. So that really helps your dogs as well. And it really helps with training, is if you put them on a schedule. Like, this is how, it's the same thing as sleep training a baby. We do this at this time. We do this, that you eat twice a day. I definitely recommend twice a day feedings. It really helps with the metabolism. And imagine if you only got to eat once a day. But it really helps with all those kind of things. It definitely helps in training because they get used to a routine that they do. So that's where we are with food. For vaccines, starting with puppies, they need 4 sets of vaccines to be up to date. You can buy a 5-in-1 shot from like the co-op. If you're not going to do anything or co-op vaccines, then by all means, get onto the co-op and get you one, because those vaccines and co-ops, because I've been in there and we've done a lot of stuff. The hospital that I worked at previously before I moved to Florida, we would sell just puppy shots. You could just come buy it and do it yourself because it's so unsanitary, the ones that they were selling at the farm supply and the co-op, because the vaccines need to be refrigerated, and any vaccines that are just sitting on a shelf at a co-op are farm supply have a lot more preservatives and additives in them to help them have a longer shelf life so they don't have to be refrigerated, as opposed to getting a vaccine from a hospital, which are better quality, have to be refrigerated, shorter shelf life. So we have to use them pretty quickly. The 5-in-1 shots, the combo vaccines that we recommend every pet gets 4. There's a couple different variations. The hospital I used to work at did DA2P. It was the distemper, adendovirus, parvo, and parainfluenza. The ones that I use at my current hospital is DHPP. It's distemper, hepatitis, parvo, and parainfluenza. Either one is really fine. It just depends on your area and what kind of diseases your area is prone to getting. But the DHPP vaccine is fine. You need 4 booster shots starting at 8 weeks old. Some places say start at 6 weeks. Research is really showing that you shouldn't start them at 6 weeks because they still have antibodies from breastfeeding from their mother, which will attack anything that you put in their body. So if you give them a vaccine before 8 weeks old, the antibodies that they're getting from their breast milk are going to attack the antibodies that you're trying to give them, and it basically cancels it out. So you may or may not be protected. You're running that risk. So I definitely suggest waiting until 8 weeks old, and then you do it every 3 weeks until they're 16 weeks at that point, in which case they would get their rabies shot, which is required by law everywhere, and you have to have that administered by a veterinarian. You can't give if you can buy a rabies shot at the co-op, you're not supposed to be able to, and that it's probably meant for livestock. So don't give that to your dog. So you do need those 4 things. There are additional vaccines that a lot of vets recommend, like leptospirosis is definitely one, Lyme vaccines. It depends on your area. I am a believer in like the canine influenza vaccine, which is usually a 2-part booster, because I definitely recommend vaccinating against both strains, which is the H3N8 and the H3N2. If you remember, H3N8 was swine flu. But it is a highly contagious upper respiratory disease that if you get it, your pet is very, very at risk of like dying. So like if somebody got canine influenza and then brought it into my hospital, I would have to shut my entire hospital down because it is so contagious. It's more contagious than Bordetella or kennel cough, which you can get from just being around a dog that has it. It's aerosol. So if a dog sneezes on a park bench and you walk past that park bench with your unvaccinated dog, it could potentially get kennel cough. Or you yourself walk past it, got on your clothes, you went home, your dog can get kennel cough that way. Kennel cough is something that's often misdiagnosed, and everybody's like, oh, he's coughing, he's got kennel cough, oh, he's sneezing, he's got kennel cough. There's a huge range of upper respiratory infections that your dog could possibly have, and it's not always kennel cough, but that is a really common one. So for sure have your dogs vaccinated against that. Some places say every 6 months, some places say every year. It depends on what the vaccine is labeled for. Intranasal vaccines are generally speaking 6 months. Some places will label them for a year. It's probably okay. Oral and injectable is a year. So it just depends on you and your personal preference. I've usually been a 6 month vaccinator for my pets, but new research has come out since they've done new vaccines stating that it can live up to a year in their system as the antibodies mature. So as long as your dog's had 2 Bordettellas, it should last for a year, but they'll get those 2 within their puppy shots. Then definitely you should be worried about preventions depending on where you live. Now, if heartworm is not a problem where you live, that's fine. I've had people that never had it, like where they live, it's not a thing, not a thing. You get heartworms from mosquitoes. An infected mosquito bites your pet, gives them heartworms. It's disgusting. It's a really sad, slow death, and treatment is very expensive and very painful. So I like HeartGuard. That's good. I use Sentinel for my pets here because it's more, that's just what everyone uses here is Sentinel. Where I came from, everybody used HeartGuard. I love the ProHeart 6 shot. It's a 6-month vaccine that keeps your pets protected against a couple intestinal parasites and heartworms. Now, definitely flea and tick prevention, because it's easier to prevent fleas and ticks than it is to get rid of an infestation. I have a couple different ones that I use depending on my pets and what their tolerance is. So my cat cheese Revolution, because it also does like ear mites, heartworms, fleas, and ticks. And a lot of cat topical preventatives don't include those things. For my dogs, for flea and tick, for Zoe, she uses NexGard, and it's a 1-month chewable, and she's used that her entire life. So I just don't really intend on switching her. And plus I have like a 2-year supply that won't expire. So that's what she's going to get. Then my big dogs use Bravecto. It's a chewable. It lasts for 3 months. Hold on. Would it even be a KP video if it wasn't a hot fucking mess? Would it even be one? Would it? No. So, sorry, I got interrupted and then I had to leave my house. Let me look at my watch. My husband called and we talked for a little while and then I had to go pick up the kids, but I still want to really finish this video to maybe have something to post and not be the worst YouTuber in the world for like 5 minutes of my fucking life. Anyway, we were talking about preventions, and it's really, really important that you use, especially heartworm prevention, if you are in an area where heartworm disease is prevalent, because I have seen it happen. I have seen dogs that have severe heartworm disease, and I have seen owners that don't treat it, and it's really, really sad. It's really unfortunate, because it's really sad for the dogs. So, moving on from that, so we've gone over what you should feed them. We've gone over picking a breed that is right for your lifestyle. We have gone over the food, vaccines, preventions, picking a dog is good for your lifestyle. Then we need to move on just briefly to adopt or shop is what a lot of the debate in the world is going to be about. Now, I personally don't have anything against buying dogs from breeders, especially a breeder that you know and you know exactly what you're going to get. So, I mean, that's fine. If you have a specific dog that you want because you've done your research and you can't find one at a shelter, buy a dog from a breeder. It's fine. As long as the breeder is reputable and you're not going to get a dog that has a lot of issues, because then that leads into that dog's going to end up at the shelter if you weren't suspecting that you were going to have to pay hundreds and hundreds of dollars to fix medical problems for your dog. So I don't, like, that's an unpopular opinion, but I don't have any issue with people buying dogs from breeders if there's a specific breed that you want. I personally adopt pets because I've seen what it's like. There are plenty of great, wonderful dogs in shelters all the time. And great, even Zoe, she's a pure-blooded corgi. She was given to me. I didn't pay $800 for her. I didn't. The most expensive animal that I own is BMO, and that's just because she had a lot of medical bills for me to be able to get her. It cost me almost $500 to get a tabby cat. You guys remember when she got hurt and then she was going to get put to sleep, and then I couldn't let that happen, and then we raised $500 in one day. It was like 400 and something, and I just paid the rest, and it wasn't a big deal. And we got her home the same day, because I couldn't let her die, and she's been a joy to my fucking life ever since, and I love her so much. But, you know, I don't really have a problem with people buying dogs that they want. Like, that's fine. Now, we will talk about some problematic breeds. It's not going to be popular, and you're not going to like it, but there are dogs that are predispositioned to certain illnesses, and that's just something I feel like most people don't know, and I feel like maybe you should know. Maybe nobody's told you. Like, boxers are predispositioned to get cancer, and they do get nodules in their mouth that look like these little hard balls on their gums, and they have to be removed. They do. Pit bulls have allergies, like skin allergies, because most pit bull breeds are white on their chest. And they, like just American Pit Bull Terriers, they are solid color dogs of any breed. You can get a million variations, but most Pit Bulls are more predispositioned to have environmental allergies. Corgis are predispositioned to have back problems. So are any long dogs like Dachshunds as well will have back problems. Boston Terriers, any brachiocephalic dog that have the mush faces, Bostons, Frenchies, English Bulldogs, they have breathing problems. There is a procedure that you can have done when they're a puppy. It's very expensive, but what they do is they go in their nasal passageway and they actually expand it so the dog can breathe better, but they're bred to have those extreme features, and that really gives them a lot of problems. So that's what a lot of people are starting to crossbreed, like Bostons and Frenchies, because it's helping with a lot of those issues that they have. Pugs as well have breathing problems, allergies. Pugs get gross when they're old, and I love pugs so much, but I cannot afford to have a pug because when it gets old, they have a lot of health problems. And any dogs that are wrinkly, their folds, if you don't wipe them every single day, can get infections in the folds in their face, or any of those wrinkly face dogs that are so cute, that also happens. You just really need to be aware, like I said, of the breed that you have. Like, I know at some point my male cat might get blocked, and that is at least a $3,000 surgery to save his life. If I can't, but he would have to have a cystotomy if I can't just break up the stones with a catheter. And it's expensive, but that's just the risk that you run when you have certain animals. And I just wish more people were more informed. So then they would know what to prepare for. Like if you have a brachiocephalic dog, you may have to have a procedure to widen their nostrils so they can breathe. Or widen their sinus cavities, really is what it is, so they can breathe better. But that's the dog that you have. If you have bulldog breeds, bully breeds, any white dog, it's gonna have some kind of allergy for their skin. They just do. Like, and they just do. And it's another thing that I think is strange, and I don't honestly know the correlation, but a solid white dog a lot of the times is deaf. Don't know why, but they are. A lot of times, they're deaf. That's just something you'll have to look out for when you're buying your dogs. So, small breeds like Chihuahuas and stuff, they have really bad teeth. You need to have their teeth cleaned professionally under anesthesia, not a fully awake dental, because that's essentially just brushing your teeth. They really do need to have a full anesthetic dental procedure once a year, because unless you're brushing their teeth every single day, their teeth are going to start to decay, just like yours. If you didn't brush your teeth for a year, they would start looking, hold on, put my numbers out, they would start looking gross. So they need to have that done. And if it's full anesthetic, they can sedate them completely. They can get full mouth x-rays. They can see what's going on under the gum line, which those non-anesthetic dental procedures, they can't get under the gum line and clean and see if there's pockets or deciduous teeth that are left behind up there, see if you have anything impacted. You need to do that. So, this has been my little public service announcement of just basic care for your dog 101. Nylobones, don't buy them, because the dogs will eat them and then they get stuck in their stomach. Be very careful with your dogs that like to shred things. I definitely recommend the Kong toys, because they're really great. And if your dog is a shredder, because if they start eating like blankets or carpets or anything, that's another really expensive exploratory surgery to get that out of their stomachs. So if you guys have any questions, or if I didn't talk about something that you wish I would have touched on, please leave it in the comments below. I may do a part 2 if I have enough questions about the dogs, and then we'll do cats next time if you guys still want to see that. As always, you can follow me on any social media account. You can follow me on Instagram at grungexglitterx. You can follow me on Twitter and Snapchat at grungexglitter, and you can follow me on Facebook at grungeandglitter-kp. I love you guys so much. Please give your doggies kisses for me, and we'll see you later. Bye.